welcome to this session. We will speak about mucus management in Muco-Obstructive disease, why and how.
This is what I tell my patients. Mucus is made of protein and carbohydrate. You probably had it for your lunch. If you leave it lying around for days, it festers. And the treatment for that horrible mouldy sandwich is not bleach spray, it's to physically remove it. You have to leave really strong messages with your patients. Here, to answer the anti-inflammatory side of stuff, at the top right hand side is a mucus plug with micro abscesses in it. You cannot clear an abscess with an antibiotic, and you cannot clear that abscess if the airway is full of mucus because there's nowhere for it to discharge.
The chest CT scan before and after show the highly efficiency of the clearance because of the device. Today, this patient has no experience any new hospitalization for infectious exacerbation, no more episodes of hemoptysis, and the expectoration level came back to the usual level. The pulmonary function is stable and the patient could return at work.
Asked the patients, what are for you the positive effects you feel from this therapy? And they said, exactly as my colleague here described before, sputum is easier to expectorate. It's an increased volume in sputum I can expectorate. I have the feeling that the deeper airways are better to clean. The sputum is a bit more fluid, and which I think is a really important point is too the shorter time for sputum mobilization.